Hello and welcome to the Canada News with your host Divya Rai. Now let's have a look at the headlines. Quebec plans normal return to school in fall without mask or class rebels. Brampton Mayor Patrick Brown held a press conference in which he informed that 72% of adult population in the city has been vaccinated. Vaccine rollout work is in full swing in Ontario and the COVID-19 case has come down significantly. Now news in detail. Quebec Education Minister says children should be able to go to school without mask or classroom bubbles in the fall as long as COVID-19 cases are low. And students are vaccinated. Authorities are banking on a relatively normal return to class, which will include field trips, open common lunchrooms, and full-time in-person attendance. He also says the success of the plan depends on making sure that at least 75% of the kids 12 to 17 vaccinated against COVID-19 and also encouraging parents and teens to book appointments. Brampton Mayor Patrick Brown in a press conference informed that 72% of the adult population in the city has been fully vaccinated. 42% of the Brampton residents under the age of 12 have been vaccinated and agreed with the stand of the provisional government to suspend international flights from Pakistan and India.
And the vaccination efforts in Peel region have been robust, and I want to applaud Dr. Lowe and Dr. Mohammed, who have been spearheading the charge locally in Brampton. 72% of adults over the age of 18 have been vaccinated, and I believe over 40% of those over 12. So this is wonderful news, and we're going in the right direction. But I would note that there is some caution in that sea of optimism over the high vaccination rates. I remain concerned about the international variant B1617, which was first found in India, now known as the Delta variant. And I just want to underline, if the government's position continues to be that there will not be restrictions on international travel, for me, which I have to say, I agree with the provincial position that the federal government should have more restrictions. But if that's not going to change, it really speaks to the fact that we do need to have an aggressive second dose strategy in our hotspots. I'm concerned that first vaccine coverage will not be adequate when it comes to some of these variants, and we've got crowded factories and warehouses, and that's how it spread out across the province initially. So we need to get second doses to our essential workers to make sure that this variant doesn't take hold like we've seen it take hold in other jurisdictions internationally. On that note, if we get the supply where we're able to give second doses, and that's a big if, because right now we're getting about 9% of the provincial allocation and we're 11% of the population. But if we get that supply, we have a vaccination campaign that is going to start today. It is called Get Back to Better Vaccinate Brampton, and we have notable community residents who have all recorded messages about why they're getting vaccinated to protect their friends, family, and their community. So stay tuned for watching some of those commercials and those messages. They'll be shared throughout the city of Brampton on why getting your vaccination is so important, and the personal reasons why many of our residents got their vaccine, whether it was looking out for a grandmother or a loved one, their neighbor. There's some pretty powerful stories about why it's so important to get vaccinated.
Vaccine rollout work is in full swing in Ontario and the COVID-19 case have come down significantly. As a result, there is a chance of reopening. Councillor Martin Medriers from the Brampton Ward number 34 briefed the city on the steps to be taken in this regard. He explained how the economy would be open in 3 phases.
We are encouraged by the province's 3-step plan for a gradual reopening. This is a reflection of our collective efforts to overcome the pandemic by placing health and public safety as our first priority. As we wait for more updates from the province, here are 3 important things to remember. First, the provincial emergency declaration, stay home orders ends today, June 2nd. And I know there's been some confusion, there's been a lot of expectation that as of today that some things would open. Essentially, the emergency brake rules are still in effect, and we're still moving towards step 1 reopening. This means it's important we keep our outings to a minimum and for essential purposes only. For example, groceries, pharmacy, healthcare services, for exercise, or for the essential work. Second, outdoor recreational amenities such as golf, sports fields, baseball diamonds are permitted, but only to get basic exercise. Outdoor fitness classes and team sports, including practice, is not permitted in sports fields or courts. Outdoor splash pads are open. Lastly, outdoor social gatherings and organized public events are allowed up to 5 people, including members of different households. So let's continue to work together and keep our focus on getting vaccinated and following safety measures in the lead up to the gradual reopening. And just lastly, I would like to just recognize that we know businesses, restaurants, patios, we've heard loud and clear, and as the mayor suggested, as soon as we get the green light from the province, we'll make sure that not only our facilities will be there, but we'll be there to assist all the local businesses where they need help. So I just want to thank everyone and thank Brampton staff for everyone coming together and putting in their hard work so that we can move into a safe reopening.
Dr. Lawrence Law, Chief Medical Officer of the Peel region, said that the number of the cases had been steadily declining and the burden on hospitals has been reduced. Dr. Law said that the city positive rate is still 10.4%. There is a need to be extra careful after the stay-at-home order is over. The Delta variant, whose first case was found in India, has its cases in the Brampton, which can lead to fourth wave, so all people must be vaccinated properly.
This week, Brampton's test positivity is at 10.4%, with a weekly incidence rate of 131 cases per 100,000. Hospitalizations also continue to resolve, meaning that more of our residents are recovering and fewer are getting sick. And vaccine coverage with first doses is improving. However, even while the stay-at-home order expires, we must continue to remain vigilant. Despite decreasing trends, our rates remain the highest in the province. And while the current trend may seem favorable, we cannot forget what a formidable foe COVID-19 has been. 3 waves and 100,000 cases in our community, many lives lost, though many more saved thanks to the sacrifices and measures that have held transmission at bay. However, we cannot grow complacent and we must remain vigilant. I've said this before, and I too know that we all want this to be over. But COVID isn't going away, and if we immediately start to act like it's over before it actually is, we will be quickly reminded that it's not. In particular, members of the science table this week have advised Peel Public Health that B1617, now known as the Delta variant, first detected in India, is increasingly being detected in Ontario, and that Peel region has the highest proportion of this variant out of the entire province. We've only just started getting back preliminary lab results and analyses from our provincial laboratory partner, and the trends being observed are concerning. B1617 is quickly replacing B117, which was the Alpha variant originally detected in the UK, and which drove our third wave across Brampton and the region of Peel. We currently have 97 cases of the Delta variant in Peel, including some that have been acquired in the community. And preliminary analysis from the science table suggests that in 1 month, the Delta variant will be the dominant strain in our region, with the rest of Ontario weeks behind. With initial signals suggesting that the Delta variant is also more transmissible and severe on top of the Alpha variant. This means we very much welcome the province's continued cautious reopening as one component to preventing a fourth wave. Caution is essential. The other component is to continue vaccinating. We have thankfully now delivered over 1.1 million doses of vaccine here in the region of Peel, reaching 72% coverage of our adult 18-plus population with first doses. We've now also achieved 40% first dose coverage in our 12 to 17-year-old population. However, science is clear that with the new variant, the new Delta variant growing, we need to move quickly to 2 doses.
66-year-old man dies at the Woodstock gas station because a car was blown up with 82 worth of gas, but instead of paying money, Stephen Madigan was hit. Expressing grief over the incident, MPP Deepak Anand demanded the prepayment system be implemented so that such headlines would not be created in future.
Thank you, Mr. Speaker. Mr. Speaker, last week my heart ached at reading the newspaper headline. 66-year-old senselessly killed during gas and dash theft in Drumbo near Woodstock. Mr. Speaker, Stephen Madison was a loving father, grandfather, and an outstanding citizen. Should this incident have happened in BC or Alberta, Mr. Speaker, this manslaughter could have been avoided. These provinces have gone ahead and made the prepayment of gas mandatory and have since then seen practically zero cases of gas and dash thefts. My Bill 231, passed with unanimous consent in the House, is advocating to make prepayment of gas mandatory so we can avoid similar tragedies going forward. We have received support letters from the Police Services, PAO, Police Services Boards, Rabba Fine Foods, Ontario Convenience Stores Association, Husky, Hasty Market, 7-Eleven, and many more. Mr. Speaker, this incident unfortunately shows us that this is not an issue just in the urban areas. This is an issue that affects all Ontarians. So I want to say thank you to all of my colleagues for your support. Let me repeat, the death of Stephen Madigan was completely avoidable. The time for action is now. So I implore all my colleagues on both sides of the aisle to keep working together to ensure to bring safety and security for fellow Ontarians. Let's make prepayment a reality and say goodbye to such headlines forever. Thank you, Mr. Speaker.
The anniversary of Saka Neela Tahara is being celebrated by Sikh Sangats all over the world. Meanwhile, NDP leader Jagmeet Singh also said that he would always raise his voice for justice for the Sikhs genocide so that it does not happen in future. On the other hand, MPP Gurratan Singh moved a motion in the Vidhan Sabha to pay homage to martyrs, which was supported by the House.
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. I want to take a moment to reflect on the Sikh genocide. Every June we remember the calculated and planned killing of Sikhs that began in Amritsar, the Golden Temple, and continued to November. This was a clear campaign by the Indian government to target and to kill Sikhs just because of who they are. We remember the lives lost because as Sikhs, it's our commitment to remember the injustices so they never happen again, not just to Sikhs, but to anyone. And in memory of the genocide, let us commit to building a world where everyone can live with peace, justice, and human rights. And let us remember those that lost their lives so we can prevent any future injustices from ever happening again.
Thank you. That concludes our member statements for this morning. I beg to inform the House that we have laid upon the table the individual members' expenditures for the fiscal year 2020-2021. Member for Brampton East has informed me that he has a point of order that he wishes to raise, and I please recognize him.
Speaker, I rise today to call for the unanimous consent of this House to observe a moment of silence to remember the countless Sikhs who were murdered by the Indian government in the June 1984 Sikh genocide, lest we forget.
Member for Brampton East is seeking the unanimous consent of the House for a moment's silence to observe and remember the victims of the Sikh genocide from 1984. Agreed? Agreed. Members will please rise.
Ontario Premier Doug Ford has announced that schools in the province will no longer reopen for individual training for the academic year. Schools have been closed for personal learning since last year due to fears of the spread of coronavirus, he said, which will not be open for personal training even during this academic year.
Now, I want to talk to you about the situation with our schools. COVID-19 has taken a significant toll on everyone in Ontario, but our children have been impacted more than most. The pandemic has disrupted their lives. It's taken away their ability to go to school, to see friends, to connect with each other. Last week, I wrote to the public health, medical, and education experts asking for their opinion on the best path forward. And it's no secret that some of them said kids should be back in school on a regional basis for the last couple of weeks of school. But here's what the experts couldn't say. They couldn't tell us that returning to in-class learning before more students and teachers are vaccinated won't lead to thousands and thousands of new cases. In fact, we've seen clearly in the modeling from Dr. Brown that returning kids and teachers back to school before they're vaccinated will lead to thousands of new cases. The experts couldn't tell us that it wouldn't risk spreading dangerous variants and avoid us from moving to other stages. It won't risk the health of our kids. Well, no one wants kids back in school more than I do. As your Premier, these aren't risks I'm willing to take. So today, I have to announce that schools will not be returning for in-class learning until the fall. I know this is difficult, very difficult news. It was a hard choice to make, but I will not, and I repeat, I will not take unnecessary risks with our children right now. The fact is, we're fighting a third wave driven by variants. And unlike the original strains, we know that some of the variants we're fighting right now are more dangerous for children. It can make younger people very, very sick.
Ontario Education Minister Stephen Leachy says the Ontario government's priority is to protect school children, staff and parents during the coronavirus. He said the decision is to reopen the school has been postponed with the advice of Science Advisory Table. He claimed that the decision was taken with a view to security.
The one constant in this pandemic has been that we have always erred on the side of caution. Caution for our students, their families, and the staff within our schools. Caution for every family in this province, young and old, urban and rural, especially with the emergence of new variants, the B.1.6.1.7.2 variant notably, that creates, as the science table said, a significant unknown. Because by remaining cautious and vigilant, we protect our summer, we protect September, and we provide stability and routine to children who have faced dramatic disruption due to this global pandemic. We have done this because safety has been our guiding light and the principle for families. Because of our cautious approach and our $1.6 billion plan, endorsed by the Chief Medical Officer of Health, Ontario has one of the lowest case rates for youth under 20 in Canada. Our cautious approach will protect our reopening, the reestablishment of camps, organized sports, small get-togethers and play dates, which will help facilitate that social, human interaction that children so desperately deserve. Now, we know how critical mental health is for our students, especially right now. We know that at home and abroad, children are facing incredible difficulty. And it's why just yesterday, our government announced an additional $31 million investment in community-based mental health supports for youth. It's why earlier this month, we announced an $80 million investment in school-based mental health services. That represents a 400% increase in investment when compared to the former Liberal government. It's why we increased investment for special education students, the highest investment in spec ed and mental health in Ontario history. And I want to be clear, learning continues in Ontario. We built up an online learning system with over 200,000 more laptops and tablets and thousands of internet connections, along with training for educators and the high standards of live Zoom-style learning.
Toronto Mayor John Tory outlines corona vaccine rollout procedure in the city of Toronto. He said the team Toronto has so far vaccinated 2.2 million people. Mayor John Tory claims that so far more than 70% of the city's population has received the first dose of the vaccination.
Our Team Toronto effort has now administered more than 2.2 million COVID-19 vaccine doses in our city, and as we announced yesterday, more than 70% of adults in our city have now received their first dose of vaccine. As I've said before, this is a milestone, but not one that causes us to slow down on our work at all. It just really reinvigorates us to get on with making sure the rest of the people get vaccinated, and I'm going to discuss a bit of that today. We're trying to find more and more ways in which we can get that first dose into people's arms, and of course the equally important second dose into people's arms as well. We are also seeing improvement in the number of new infections that are being reported, and Dr. Davila will comment on that later today. I just want to say thank you to everybody who is participating, because we wouldn't be able to put 2 million plus doses into people's arms if they weren't showing up to have it done. And I want to say thank you to people who are obviously following public health guidelines that are helping us to get the rate of infection down as well. Our work to get as many people vaccinated as possible is continuing. And the first VaxTO citywide telephone town hall will be held tonight starting at 6 o'clock. The town hall is meant to give people as much information as possible about getting vaccinated. We know that the more information people have, the more likely they are to get vaccinated. And it's okay to have questions about the vaccines and about the process. We're having the town hall to address those questions, both for the people that are asking the questions and for all those who are listening and may not get a chance to ask a question, so that everybody has the information they need. The call out to encourage people to join the telephone town hall tonight has itself, just the call out inviting people to the town hall, has resulted in almost 4,900 people connecting directly to the provincial booking line to get vaccinated.
Toronto Medical Officer Dr. Alan Diabla reports on the COVID-19 outbreaks in Toronto. She said that the 328 new cases were reported in the city today and 774 patients were admitted in the hospitals. 221 are critically ill and are admitted in the ICU. Dr. Diabla also confirmed the death of 14 more patients due to COVID-19.
Today, I am reporting 328 new cases of COVID-19. 774 people are in the hospital and 221 people are in the ICU. I'm saddened to report 14 deaths today. To illustrate how far we've come in a month, I want to revisit briefly the figures I reported on Monday, May the 3rd. The average then was 1,037 new COVID-19 cases per day. 1,142 people were in the hospital and 272 were in the ICU. The dramatic change between then and now speaks for itself. Cases have declined significantly, and hospitalizations, while improving, are doing so more modestly, as is expected. The changing numbers reflect people taking to heart the stay-at-home order, the steps for self-protection, and the success of the vaccination campaign. As the Mayor just stated, already we've seen significant vaccination uptake for people ages 12 to 17. In Toronto, close to 75,000 in that age group have already received a first dose of vaccine. That's 46% of this group. A youth vaccination strategy is being co-led by Toronto Public Health and Sick Kids Hospital. Youth initiatives to support vaccination have so far included city-run immunization clinics, hospital clinics, school pop-up clinics, and mobile clinics led by hospitals, Ontario health teams, and community partners. As we move through June, you will see a focused effort to provide vaccination opportunities.
Canada's Vice President and Finance Minister Christine Freeland discusses Canada Recovery Hiring Framework. The program will provide up to 50% subsidy to eligible businesses. This program will be implemented from 6th June. The program has been borrowed as relief during the COVID-19.
Since the onset of the COVID pandemic, we have done whatever it takes to help Canadian workers and businesses weather the storm. And we continue to do that. Today, I'm announcing details about the new Canada Recovery Hiring Program. This new support measure will be key to helping small and medium-sized businesses across Canada come roaring back. Plus important encore, je peux dire aux petites entreprises qu'une fois que la loi d'exécution de budget, le projet de loi C-30, recevra la sanction royale, ce programme sera rétroactif au 6 juin. Ce qui veut dire que, en réalité, il s'appliquera à partir de cet dimanche. Et il couvrir jusqu'à 50% de l'augmentation de la masse salariale payée par les employeurs admissibles, et ce jusqu'au 20 novembre de cette année. Il s'agit d'un programme qui vise l'emploi et la croissance. Il est indispensable à la relance de nos petites et moyennes entreprises, qui, elle, est indispensable à notre relance en général. Ce programme va aider les gens, autant les propriétaires d'entreprises que les travailleurs, à reprendre le cours de leur vie. Au cours des 15 derniers mois, nous nous sommes constamment adaptés aux nouveaux besoins des entreprises au fil de l'évolution de la crise. Et même si nous voyons maintenant la lumière au bout du tunnel, grâce à la sagesse des Canadiens.
So that's all we have in this bulletin. Thanks for watching. Stay tuned for more updated news.